Hello, I am here and going to talk to. Hello, I'm here and going to talk to John, a 78-year-old man who presents with feeling lightheaded, dizzy, and short of breath. You do not. It says that you deny chest pain, fever, or chills, and you have had problems with abdominal pain and dark black stool for 3 days. Medical history is coronary artery disease, hypertension, AFib, and arthritis. Your labs, your hemoglobin and your hematocrit was a little bit on the low side. Everything else looked fairly good. Hematocrit is a blood test that measures the number and the size of red blood cells. It gives you a percentage of red blood cells found in your whole blood in your blood. Hemoglobin is the part of the red blood cell that carries the oxygen to different parts of your body, every part of your body. Both hemoglobin and hematocrit are measured to check for anemia. 3 times the hemoglobin level equals the hematocrit. So a normal hemoglobin level for a healthy adult is 12 to 15. Your ratio is within normal limits, but you both your hemoglobin and your hematocrit are too low. You presented with abdominal pain, complaints of black stool for the last few days. I'm worried that you may have uh, maybe bleeding internally. We're going to check that out. Slow chronic blood loss within the body, such as from a peptic ulcer, a hiatal hernia, colon polyp, or colorectal cancer, even can cause iron deficiency anemia, which you have. I am so sorry. Gastrointestinal GI bleeding can result from regular use of some over-the-counter pain relievers, especially aspirin. With your arthritis, have you been using aspirin a lot? You also have a history of AFib. Iron deficiency anemia may lead to rapid or irregular heartbeat. Your heart must pump more blood to compensate for the lack of oxygen carried in your blood when you're anemic. So this can lead to enlarged heart or heart failure. You already have AFib, so we're going to have to keep a really good eye on that. You don't have any issues with heredity. As you're 78 years old, and I went through your list, you're in pretty good shape for a 78-year-old male. So, what you can do though, you can eat foods rich in iron, which include red meat, pork, poultry, seafood, beans, dark green leafy vegetables like spinach, dried fruit such as raisins and apricots, iron fortified cereals, breads and pastas, and peas. You could also enhance your body's absorption of iron by drinking citrus juice or eating other foods rich in vitamin C while you're eating the high iron foods. These include high in vitamin C includes broccoli, grapefruit, kiwi, leafy greens, melons, oranges, peppers, strawberries, tangerines, and even tomatoes. In the meantime, what we're going to do is an endoscopy and a colonoscopy. We're going to check to see if you have a bleed. The endoscopy we'll use a lighted tube equipped with a video camera. It'll pass down through your throat into your stomach, and that'll allow us to view your esophagus, your stomach, look for sources of bleeding. Also, I talked about the colonoscopy as well. It's also a thin, flexible tube with a video camera on it inserted into the rectum, and it's guided through your colon so we can get a better look there as well for internal bleeding. So basically, I need you to make sure you're coming to those appointments. And in the meantime, I will probably start you on some iron supplements. And we'll do the endoscopy and the colonoscopy to rule out the bleed, or to find the bleed rather. And in the meantime, try eating some sources of vitamin C as well as iron to increase that as well. That is all I have to tell you. So we'll follow up and we'll go from there. Thanks.